Hi everyone, welcome back. Today we are going to talk about pharynx, and here at the side you can see the diagrammatic representation of sagittal section of face for the reference diagram. So let's start the topic with introduction of pharynx. Pharynx is a muscular and tubular part of throat. It is a shared pathway for both air and food. It is an essential intersection where respiratory and digestive system meet. That means whether you are breathing, swallowing, speaking, or singing your heart out, the pharynx is involved. Anatomical location of pharynx. Anatomically, pharynx is located behind the nasal cavity, behind oral cavity, and behind larynx. And based on this, that which part of pharynx is located behind which cavity or structure, pharynx is divided into three anatomical parts. The part of pharynx that is located behind nasal cavity is called as nasopharynx. The part of pharynx that is located behind the oral cavity is called as oropharynx, and the part of pharynx that is located behind the larynx is called as laryngopharynx. So overall, pharynx is divided into three anatomical parts. First is nasopharynx, second is oropharynx, and third is laryngopharynx. Further talking about its anatomical location, it starts superiorly from below the cranial cavity, just below the sphenoid bone, and it ends inferiorly to esophagus and larynx. Shape of pharynx. Pharynx is funnel-shaped structure. Its upper wider end lie under the skull just below the sphenoid bone, and its lower narrow end become continuous with the esophagus opposite to the sixth cervical vertebra. The pharynx has muscular membranous wall. That means the wall of pharynx has muscles and membranes. It do not have any cartilage or bone. But this wall of muscular membranous wall is deficient anteriorly, and anteriorly it is replaced by a posterior opening into the nose, opening onto the mouth, and the inlet of the pharynx. By the means of auditory tube, the mucous membrane is also continuous with that of the tympanic cavity. Interior of pharynx. As we earlier said, that pharynx is divided into three parts or three anatomical parts, that are nasal pharynx, oral pharynx, and laryngeal pharynx. Now we will talk about these parts one by one. First is nasopharynx. That lies above the soft palate and behind the nasal cavity. As you can see here in diagram, the yellow color area is the nasopharynx. In the submucosa of nasopharynx roof, there is a collection of lymphatic tissue that is called as pharyngeal tonsils. Then there is pharyngeal isthmus that is opening in the floor between the soft palate and posterior pharyngeal wall. On the lateral wall, there is opening of auditory tube and there is the elevated ridge which is called as tubal elevation. Then there is a pharyngeal recess, that is a depression in the pharyngeal wall behind the tubal elevation. And then there is salpingopharyngeal fold, that is a vertical fold of mucous membrane that covers the salpingopharyngeus muscle. Next part of pharynx is oropharynx. As you can see here in diagram, the green color part of the pharynx is oropharynx. It lies behind the oral cavity. The floor of oropharynx is formed by posterior one-third of tongue and the interval between tongue and epiglottis. In the midline of oropharynx, there is median glossoepiglottic fold, and on each side there is a lateral glossoepiglottic fold. And the depression on each side of median glossoepiglottic fold is called as valvular. You can better understand this in this diagram. Here you can see the median and lateral glossoepiglottic fold, and the depression on each side of median glossoepiglottic fold is called as valvular. Then on the lateral wall of each surface of oropharynx, there is palatoglossal fold and palatopharyngeal fold or arches. And there is palatine tonsil that is placed between palatoglossal fold and palatopharyngeal fold. Palatoglossal fold or arch is a fold of mucous membrane that covers the palatoglossus muscle. And the palatopharyngeal fold or arch is a mucous membrane fold that covers the palatopharyngeus muscle. And between these two, palatoglossal arch and palatopharyngeal arch, there is a pharyngeal tonsils present there. Palatine tonsils. Here you can see in this diagram. You can also see palatoglossal fold and palatopharyngeal fold here, and between palatoglossal fold and palatopharyngeal fold there is palatine tonsils present there. Now let's talk about the third part of pharynx, that is laryngopharynx. That is the lowest part of the pharynx. It lies behind the opening into the larynx. The lateral wall of it is formed by thyroid cartilage and thyrohyoid membrane. There is piriform fossa, that is a depression on the mucous membrane on each side of laryngeal inlet. It marks the final stretch before its split between the esophagus that leads to stomach and trachea that leads to the lung. This part plays a critical role in making sure that food doesn't go down to the wrong pipe. Sensory nerve supply of pharynx. Sensory nerve supply of pharynx is based on what anatomical part of pharynx we are giving the sensory nerve supply. Our nerve supply is there. If we talk about nasal pharynx, it is supplied by maxillary nerve, that is the branch of trigeminal nerve. If we talk about oral pharynx, that is supplied by glossopharyngeal nerve. And if we talk about laryngeal pharynx, it is supplied by internal laryngeal branch of vagus nerve. Blood supply of pharynx. Blood supply of pharynx is by ascending pharyngeal artery, tonsillar branch of facial arteries, and branches of maxillary and lingual arteries. Lymph drainage of pharynx. Lymph drainage of pharynx is by two ways. Either it is direct lymph drainage or either it is indirect lymph drainage. The lymph drains directly into the deep cervical lymph nodes, but if it do not drain directly, it drains indirectly through retropharyngeal or paratracheal nodes into the deep cervical nodes. Functions of pharynx. Pharynx is multitasker with several vital functions. Number 1. Respiratory function, as it guides air from the nose and mouth down into the lungs. Second. Digestive function, as it moves food and fluid from mouth to the esophagus. Third. Speech and resonance, as it acts as a resonating chamber that helps produce clear vocal sound. Fourth. Immunological roles, as it contains lymphatic tissue such as tonsils that help fight pathogens entering through the mouth or nose. So these are the functions of pharynx. Muscular structures of pharynx. The walls of pharynx are made up of layers of skeletal muscles. These include circular constrictor muscles that include superior constrictor muscle, middle constrictor muscle, and inferior constrictor muscles. And these muscles help squeeze food downward during swallowing. And then there are other type of muscles that are interspersed between these circular muscles, and they are longitudinal muscles like stylopharyngeus muscle, salpingopharyngeus muscle, and palatopharyngeus muscle. They lift and widen the pharynx as needed. Clinical significance of pharynx. Diseases and disorders of pharynx can be quite common and varied. First is pharyngitis, that is a sore throat that is caused by inflammation that may be viral or bacterial infection. Second is tonsillitis, that is infection of tonsils located in the oropharynx. Third is sleep apnea, that is when the pharyngeal airway can collapse during sleep, thus causing or obstructing breathing. Fourth is cancer, as pharyngeal cancers can occur or they are often associated with smoking or human papilloma virus infection. Now let's talk about fun facts about pharynx. Number 1. Pharynx allows you to breathe through your mouth while chewing. Think about how multitasking friendly your body is. Second, tonsils are your body bouncers. They stand guard and alert your immune system when unwelcome microorganisms sneak in. Third, some animals like whales have uniquely adopted pharynxes that enable them to separate breathing from feeding even more efficiently. Fourth, pharynx is highly responsive to reflexes as it is involved in gag reflex, which helps in prevent choking. Fifth, when you yawn, your pharynx expands, helping increase airflow and cool your brain. And this was all about pharynx. Hopefully you liked the video. Thank you for watching.